Hi, everyone. It's Dr. Lindner. In this next section, we're going to look at white blood cells, or the leukocytes. So the leukocytes contain a nucleus. They have organelles, but the white blood cells are not going to carry hemoglobin, which was what red blood cells carried. Leukocytes, we can classify them as either being granular or agranular. Again, once we put the A in front of the word, it means without. So granular contains vesicles that appear when the cells are stained. And depending on whether we use an acidic stain or a basic stain, right? Basophil, eosinophil, this is an acidic stain, this is a basic stain. Neutra is neutral stain. And phil in each of these words come from philos, like philosophy, friend of, to like, to love. So granular sites are granular leukocytes. And the abbreviation that I gave in an earlier video was BEN, B-E-N, was basophil, eosinophil, and neutrophil. And the agranular sites, meaning the cytoplasm does not contain any granules, that's going to be LM, that's your lymphocytes and your monocytes. So now we could take a closer look and see, all right, on the left-hand side, we are looking at the granular sites, and clearly you can see in the cytoplasm of all three of these, we do have granulations, whereas the agranular sites without granules, the cytoplasm is free of any of those small speckled sandy type of granules. The granular sites are the basophils, eosinophils, and neutrophils. And when you get blood work and you get a complete blood count, these things are broken down. So you can get a neutrophil count, an eosinophil count, and a basophil count. And having low or high amounts of these are somewhat clues or diagnostic in terms of differential diagnoses. Now, neutrophils are phagocytic type of cells. They phagocytize bacteria and other pathogens. They're not phagocytes, they just are, they have phagocytic activity by breaking down bacteria. When neutrophil count is high, it's typically high with a bacterial infection. Whereas lymphocytes down here on the bottom right, which is an agranular site, when these are high, it's a viral infection, typically. So how to remember that? I tell students to remember, never bet Las Vegas. Never bet Las Vegas. Neutrophils, bacteria, lymphocytes, viral. That's if they're high. Okay. Eosinophils are typically associated with allergies, as are basophils. Basophils are going to release histamine and heparin. These are kind of like blood thinners. Histamine is a dilator. And eosinophils can make something called histamine ACE. So whereas your basophils are making histamine, eosinophils can try and regulate that, and it makes histamine ACE to try and break that down. Eosinophils are also seen with parasitic infections. Neutrophils typically have 3 to 5 heads to the nucleus. In this one, we see 1, 2, we see 3 heads to the nucleus, whereas an eosinophil is typically bilobed. We see 2 heads to the nucleus with an eosinophil. A basophil is typically, I'm not a big fan of this picture, but it's somewhat, the basophil nucleus is somewhat obscured by dark staining granules, And I'll show you a better picture of that. I think I have it coming up here. So on the one on the left, we see a neutrophil, and looks like we have 1, 2, 3, 4. This one looks like it has 5 heads to the nucleus. The eosinophil, 1, it's got 2 lobes. And the eosinophil, the cytoplasmic granules are larger and they're red. With a basophil, which is a basic stain, remember eosinophil is an acidic stain, the basophil is the darker stain, the nucleus is obscured by the dark staining granules. Okay, so keep that in mind. It's hard, if it's tough to see the nucleus, it's a basophil. If it's dark, reddish granulations and they're larger and it's bilobe nucleus, it's an eosinophil. Neutrophil, also red granules, but they're much, much smaller in relationship to the eosinophil, and always 3 to 5 heads to the nucleus. So now we're left with a lymphocyte and a monocyte. When you look at a lymphocyte, it's agranular. When you look at a monocyte, it's agranular. The lymphocyte nucleus that we see here is just about as large as the actual cell, whereas the monocyte has this kidney bean-shaped nucleus, and it's pretty large, as is here, right? The monocyte is pretty large. It's got that kidney bean-shaped. The monocyte is a true, monocytes become macrophages. The monocyte is in circulation. When it finds damage in tissues, the monocyte slips into the tissue, and now it's called a macrophage. And there's different types of macrophages. If it's in the brain, it's called a microglial cell. If it's in the liver, they're called, if it's in the liver, it's called a Kupffer cell. If it's in the lung, it's called an alveolar dust cell. So they just kind of change their names. If it's in a blood vessel and it's eating up damaged cholesterol, they call it a foam cell. So macrophages have different names depending on the type of tissue that they have migrated into. Lymphocytes are involved in the secretion of antibodies. These are linked to viruses. So if the lymphocyte count is high, it's a viral infection. If the neutrophil count is high, it's a bacterial infection. If eosinophil count is high, we're thinking allergies or parasites. There's something else I wanted you to know. Let me go back here. And it is another mnemonic that's never let my engine blow. And it's 60%, 30%, 60%, 30%, 6, 3, 1. 60, 30, 6, 3, 1. 60, 30, 6, 3, 1. Never let my engine blow. The N is neutrophil, L is lymphocyte, monocyte, eosinophil, basophil. 60%, 30%, 6, 3, 1. So when we get to neutrophil, neutrophils are mature circulating phagocytes, and they represent 60% of the total number of circulating white blood cells. So neutrophils make up 60% of the white blood cells. Lymphocytes, 30%. Monocytes, 6%. Eosinophils, 3%. Basophils, 1%. Never let my engine blow. 60, 30, 6, 3, 1. So the neutrophil's function, they're going to migrate to an area of an infection pretty fast. They are the primary white blood cell. It arrives first. They arrive there faster than does a monocyte. And neutrophils, when their granules degranulate, when they open up and they degranulate, they're going to release this hydrolytic, proteolytic enzymes where they are designed to disintegrate pathogens. Neutrophils also secrete something called alkaline phosphatase. Again, anything that ends in ase is an enzyme. Neutrophils are also going to secrete a super reactive form of oxygen, including hydrogen peroxide, right? Think of what many people put on a cut. They'll open up the brown bottle, put it on a little piece of cotton and put it on a cut, hydrogen peroxide. Here's a neutrophil, 1, 2, 3 heads to the nucleus. 3 heads, 3 to 5. Eosinophil makes up 3%. Remember 60, 30, 6, 3, 1. So eosinophils make up about 3%. They have those larger red granules, and eosinophils also are going to degranulate, releasing these hydrolytic, proteolytic enzymes that are used to break down pathogens. The eosinophils will also release acid phosphatase, not alkaline phosphatase, but acid phosphatase. And they also secrete histamine ACE. That's the enzyme that helps break down histamine. Eosinophils are pretty high when you have some sort of allergic reaction, also a sort of parasitic reaction. So parasites and allergies are going to have a high eosinophil count. These are typically bilobed and have those larger red staining granules. The basophil makes up about 1%. They are similar to a mast cell. Remember I said mast cells are found in the skin, in the respiratory tract, and they're also found in the gut. And they are responsible for releasing histamine. Also seen with allergic type of reactions. The basophil and the mast cell produce and secrete heparin, which is a blood thinner. It's an anticoagulant. Histamine, which is a vasodilator. It opens up the blood vessel. And serotonin. Isn't that amazing that white blood cells produce serotonin? When you think of serotonin, you think of a neurotransmitter that helps you feel good. And that's probably why when you're sick and not feeling well, it may have something to do with serotonin production. They're probably not working too well in producing that. Here's your basophil. Remember, the nucleus is obscured by these dark staining granules. White blood cells can live for several months and even years, and their main function is to combat invading microbes. During an invasion, many white blood cells are able to leave the bloodstream and collect at the site of the invasion. When they leave the blood vessels and they move into the tissues that are affected, it's called emigration or diapedesis. So diapedesis, you can see the emigration is when you have, looks like a neutrophil right here. It starts to stick to the endothelial lining. It starts to roll and stick, and then it squeezes on through and it gets to the damaged area. Okay. In general, an elevation in white blood cells usually indicates some degree of an infection of some sort and inflammation. A low white blood cell count can develop due to different causes, and we'll show you what it means if there's low amounts or what it means if there's high amounts. So doing a type of differential white blood cell count is important. So if we see the neutrophil, the left column is what a high amount would indicate. And then on the right-hand side, what a low count would indicate. So if the neutrophil count is high, we're thinking there's a bacterial infection. But we'll see it in burn victims. We'll see it when someone's under lots of stress and if they are inflamed. A low white blood count can be seen with radiation exposure, drug toxicity, low B12, a B12 deficiency, and an autoimmune condition called SLE, systemic lupus erythematosus. Okay, this is often seen, SLE is typically seen, people have like a little bit of a red rash on top of the face and the nose. Okay, if the lymphocytes are high, that's with a viral infection. Some forms of leukemias and mononucleosis, infectious mono. If it's a low lymphocyte count, we see that with prolonged illness, we'll see with HIV, immunosuppression, or if people are chronically treated with cortisol or cortisone and corticosteroids. If the monocyte count is high, monocytes are seen with viral and fungal infections, TB, tuberculosis, leukemias, and other chronic illness. If it's low, we're thinking that there's a problem with the bone marrow. There's a bone marrow suppression for some reason, and it's also seen with cortisol use or cortisone and corticosteroids. The eosinophils are seen high with allergies and parasites or autoimmune diseases, and it's low with drugs, toxicity, stress, and an acute allergic response, not chronic, but an acute allergic reaction. Basophils are also seen with allergic reactions because they produce histamine A. The eosinophil is producing histamine. It's seen with leukemias, cancers, and a hypoactive thyroid. It's low during pregnancy. It's low during ovulation, stress, and also hyperthyroidism. So when we see a basophil issue, whether it's too high or too low, thyroid function has to be evaluated and assessed. Lymphocytes, those are, remember, they have a large nucleus, about as large as the cell, very little cytoplasm. But lymphocytes, we typically talk about those two flavors, B cells and T cells, and there's also the natural killer cells. Lymphocytes, remember, never let my engine blow, 60-30, 6-3-1. So they represent 30% of the circulating white blood cells. This is a lymphocyte. The nucleus is just about as large as the cell. Remember the B lymphocytes, the B for bone marrow, it's made in the bone marrow, and they migrate to lymph nodes where plasma cells can make those antibodies or the immunoglobulin cells. So think of it as the B lymphocytes evolve into plasma cells, and the plasma cells produce antibodies, and they're going to provide us with antibody or humoral mediated type of immunity. The T lymphocytes, think of the T, they're pre-processed in the thymus, and they are phagocytic. And the T lymphocytes provide us with cell-mediated immunity. T4 cells and T8 cells, you'll hear those a lot. The T4 cells help the T8 cells destroy invaders. So the T4 cells are very important, and it's the T4 cell count that really takes a hit in acquired immune deficiency syndrome known as AIDS. The NK cells are the natural killer cells. These are the type of lymphocytes. They don't fit the category of B cells or T cells. The natural killer cells are going to attack a wide variety of microbial pathogens and even certain types of tumors. Now remember the monocytes, these are circulating phagocytes. They're always in circulation until they migrate into a tissue where they become a macrophage. If they're in the spleen, it's called splenic macrophage. If it's in the liver, it's called a Kupffer cell. In the brain, it's called a microglial cell. In the lung, they're called alveolar macrophages. And in the skin, they can be referred to as histiocytes. Here's a large cell. You can see it's kidney bean shaped. It's agranular. So that is a monocyte. The megakaryocyte, that's the one that I said in an earlier video. Think of a large plate of glass that you drop, and then glass breaks into thousands of fragments, okay? But no nucleus in those fragments. These are platelets, okay? And the platelets, they don't live for a long period of time. They live for about 5 to 9 days, but platelets are involved in forming a clot. In order to form a clot, we need calcium and we need vitamin K, both very, very important. In terms of clotting, we call it hemostasis. That's the sequence of response that stops bleeding. It typically involves a vascular spasm. Whenever there is a clot, And I have felt this in patients before, and I've had to refer them to a hospital where patient will come in and they'll have very, very stiff, tight neck, and they'll think I'm going to go to my doctor of chiropractic, and he or she is going to help me with the stiff neck, but the stiffness of the muscle is muscle spasming to limit movement and head rotation to protect the blood vessels because there's some sort of clot that's forming there. So there can also be vascular spasms. There's a platelet plug that will form, and then eventually there's a clot that forms. Now, I don't need you or want you to memorize the clotting cascade and the sequence of events or differentiating the extrinsic pathway from the intrinsic pathway, but I just want you to see how important calcium is, right? And that's why we have these hormones like calcitonin and parathyroid hormone that are regulating the calcium levels, because it's needed for muscle contraction, it's needed as a cofactor, it's needed for bone density, but it's needed for clotting mechanisms as well. We just don't need calcium, but we also need vitamin K in order for clots to form. And you can see terms like thrombin, we can see fibrinogen. Fibrinogen, anything that ends in -ogen is inactive. Fibrinogen needs to be activated into fibrin. Okay, what does that activation is you see that prothrombin gets converted to thrombin. Again, you need calcium for that. And thrombin is what converts fibrinogen into fibrin. And that's really what helps us clot. So once the clot forms, it retracts, it tightens to pull the edges of the damaged vessel together. And we know that vitamin K is also needed for a clot to form. It's used in the synthesis of 4 clotting factors. Again, I'm not going to ask you which clotting factors are involved, but it is important to know that we need vitamin K and we need calcium. Vitamin K is really important. In fact, when people need vitamin D, we don't give it without vitamin K anymore. Vitamin D helps us absorb calcium, but now we have calcium in the blood vessels. We need vitamin K to drive calcium from the blood vessels into the bone. Okay, and that's because vitamin K is needed for something called matrix GLA protein, and matrix GLA protein drives calcium from the blood vessels into the bone. If we don't have vitamin K, we can't drive calcium from the blood vessels into the bone, and blood vessels can calcify. They harden. And that means blood vessels can dilate, blood pressure can go up. Okay, so keep that in mind. Okay, when we come back, we'll talk about different types of blood groups.